All right, pigs. Got work just to do. I told you this is a lot. All right, similar themes for porcine respiratory diseases: viral, predisposing to bacterial, fungus, and pigs, especially one. All right, so PRRS and PCV2, these two diseases have a lot of clinical and pathologic overlap. They're very similar. You'll talk about this again in repro. This abortions. Okay, I will talk about influenza because it's really important. So influenza has rules. These are host-specific or species-specific infections. However, there is significant antigenic drift and shift. You guys know those?
Yes.
Yes. Well, that was a big yes. Like, please don't tell us about that. Okay, so the shift is like the Lego pieces. So we can get an H from a pig and from a bird, and we can make a new virus that can infect pigs and birds because of that, the shift, the recombination. What causes that? And the drift is why we get a new vaccine here, because it keeps changing. Similar to humans, seasonal outbreaks, cold, stress, predisposed, high morbidity, low mortality. So everybody gets sick, nobody dies. It's like human flu. All right, so the big part of swine influenza is this big cross-species transmission risk. So pigs have the cell surface receptors for both, well, for pig and then for human and for avian strains. So they're essentially like a mixing vat for creating new flus, which is why we're so worried about them. So that's a reassortment host. They infect with multiple viruses, and then those Lego pieces are allowed to recombine. Make brand new viruses. So much fun. Okay, so again, it's not typical to see these infectious agents alone, these viruses. Usually by the time an animal dies and comes to necropsy, so you won't usually see lesions of pure influenza infection unless maybe it's a neonate or it's got immunocompromised, something else wrong with it. Because remember, everybody gets sick, nobody dies, right? They're not coming to me. I don't see them. Diagnosis is by PCR. It's the easiest way to go. The viral titers are going to be highest 24 hours post-infection, and then they will disappear by 72. So you want to test early. You want to test pigs that are clinical early in the course of disease. So test a sick pig. It's going to go up. And if you're taking a lung sample from a deceased animal, sample from the affected area, this cranial origin. All right, PCV2 is another confusing one that looks just like PRRS. Not going to talk about it. Jaundice. I will talk about jaundice. So jaundice is underlined not because it's particularly common in PCV2, but if you see jaundice, you should say that's PCV2, not PRRS, because they look very similar, but jaundice is a thing that can separate them. So not common, but if you see it, think PCV2, not PRRS. Co-infections with PRRS, PCV2, and other things are also so common. And it's even more confusing. I feel like I should apologize to you guys every time I put this up. Like, I'm sorry you have to learn this for now. Like, this was like the hardest set of diseases. Okay. Yeah, lots of syndromes with PCV2. Probably talk about these in other. Talk about dermatitis, propagated syndrome, derm. So it does a lot of things. Multisystemic, big deal for pigs. Causes botryoid inclusion bodies. Botryoid means grape-like. So there they are. There's a little cluster of grape inclusions in macrophages. This is an IHC, immunohistochemistry, staining for PCV2 antigen. Okay, respiratory coronavirus, very similar to coronaviruses of other species. The important point for this is this causes cross-reaction with the transmissible gastroenteritis virus on serology. So this is one you don't want to run a antibody titer for it to get cross reaction. This other virus. Right. Who's watched Contagion already? Almost everybody. Does this sound familiar? The virus, bats and pigs. This is the one that was real based on this. The movie was not real, but it was based on this real life actual virus. I'm not sure how much longer I can call this emerging because now it's been like 30 years. I still have it in my head as an emerging disease. But this is a spillover from fruit bats, primarily in other countries, but pigs are the main source of infection for humans. So just like in the movie, bats will roost in these pig barns and they'll eat poop and do other things on the pigs who will pick up the virus. And then that's the source of exposure for the human handlers. This is a paramyxovirus rule. So remember, distemper is a prototype. We're going to infect multiple cell types. So pneumonia and encephalitis, it's like distemper, lymphoid necrosis, it's like distemper. This one can also cause vasculitis. So pretty severe disease, especially in humans, no disease in bats. Atrophic rhinitis is a very economically important worldwide disease of pigs. The key sign is deformation of the snout and the face with turbinate atrophy. So this is a multifactorial disease. It's infection with Bordetella, and that kind of lowers your respiratory immunity, and then you get colonized by specific toxigenic strains of Pasteurella multocida. And those toxins that this guy produces cause the osteoclast to actually resorb the turbinate. So you're losing bone in here, and that's why the face becomes deformed. It's also an important disease of guinea pigs. However, we know that in guinea pigs, supplementing with calcium seems to protect them. I don't know if anybody's tried that in non-guinea pigs, like real pigs, but throwing that out there to you pig people, maybe it'll work. So here's what that looks like. This is essentially a normal cross-section of turbinates like this. And you can see the nice like butterflies. So this would be kind of an early or mild infection. You've got loss down here in these ventral portions. Here's one where it's getting more warm. You've actually got deviation of the septum and pretty much total loss of these dorsal areas of turbinates. And then here you have so think about what your nasal cavity does for you, and then what happens if you don't have those turbinates, right? So these guys cannot filter. They've lost a lot of filter function. They've lost that humidity and warming of the air. So these guys are going to be very predisposed to developing other respiratory infections. All right, not going to talk about the pleural pneumonias. Mycoplasma and swine, we call it enzootic pneumonia of swine. I don't know why we feel like we have to name every single syndrome a different thing, but follows the mycoplasma rules of subclinical infections and carriers are common. It's kind of a chronic, slow-burning disease. The big importance is it's going to predispose you to other respiratory infections. Right, so bacterial bronchopneumonia in pigs, variations on a theme. You should recognize a lot of these by now. Strep suis and Haemophilus parasuis are the two new ones. Suis is pig, so this is strep pig. Classic lesions, bacterial bronchopneumonia, cranioventral consolidation. There's some fibrin exuding onto the pleural surface. Gross. These are very consolidated. They've lost their nice fluffy texture and they look kind of firm and kind of gray. Fungal pneumonia. This is not specific to pigs, but it is most common in pigs, and the times I've seen it were in laboratory raised pigs who were immunosuppressed. So the big thing about pneumocystis is also a human infection. Humans have their own pneumocystis. So this is a really important opportunistic infection in immunocompromised people, lab animals. non-lab animals. Monkeys with SIV, we were cystis. But this is an atypical fungus that acts like a protozoan. So it's kind of a weird one. The lesions are can be diffuse or patchy, but the classic look is lungs that are very, very rubbery. So it'll look kind of like an interstitial pneumonia where the lungs are very full, they fail to deflate, they have a very firm, thick, rubbery texture. On histo, they have kind of a non-specific appearance. So see all this kind of fluffy material in the alveoli? There's the alveolar septum right here. So we're in an alveolus, and all of this pink, fluffy, goopy stuff that I can't really tell from edema, that's the Pneumocystis. These are all bugs in here. Stain them with a fungal stain, you can see them. Otherwise, they just look like fluffy schmoo.